Hi, I'm Dr. Michael Craig with Dr. Spine Chiropractic Clinic in Whitefield. I want to talk to you today a little bit about pain. A lot of my patients come to me and ask me questions such as, Doctor, I'm getting chiropractic care, but what else can I do for myself to get rid of this pain? Like I have a pain in the neck, I have low back pain, mid back pain, wherever the pain may be. What can I do to help myself? This video is about how to take control of your own pain. Pain always involves the nervous system. Whereas the nervous system may not involve pain, pain always involves the nervous system. So if you're feeling pain, there's some nerve that's feeling that pain. So rest assured that the nerve can feel pain in one of three different ways. First of all, you could have nerve pain as a result of inflammation. Inflammation in the cells, inflammation in the muscles, inflammation in the discs or the soft tissue that surround the vertebra. The second is a physical cause. In other words, you may have an impingement of a nerve which is causing pain. Chiropractic largely addresses these particular issues because, for example, if you have a spine, you're going to have inflexibility in certain aspects of that spine, which may lead to fixation or stress in that area. When that happens, usually there's a swelling or an inflammation surrounding these nerve roots that come out from the spine, and you can feel pain as a result. Sometimes there's a direct impingement, as in the case of a herniation of a disc. You can have a herniation such as this example right here in the low back. The disc begins to swell and affects the nerve roots that come out from the low back segment, either L4 or L5. This can be a direct impingement and what I would call a physical cause of pain. Same thing happens in pain with pain if you have a shoulder injury or any kind of injury. That would be a physical cause of pain. So the first cause I mentioned is inflammation, swelling, which affects the tissues and the cells, which can cause pain. Second is a physical impingement. Now you can have both together. In other words, you could have inflammation of a disc and you could have pain associated with that, and there's also impingement involved. The third cause of pain, which is so little understood, but this is one of the major causes, is mental emotional. If you have a particular job that you hate, or there's some trouble with your family, something is going on, this can contribute mightily to your state of mind and also to the pain that results because of this problem that you're having or because of this injury to your mind, emotions, that type of thing. Now, in terms of inflammation caused by chemical changes, in other words, there may be two causes for that. One is diet, in other words, what you're eating, you're not assimilating what you're eating properly. Or two, you're eating the wrong things and you could be poisoning yourself either very subtly or directly. For example, if you smoke cigarettes or if you take certain chemicals or drugs or whatever. Drugs, even though they get rid of pain, drugs primarily are designed to mask the pain. Now when you take drugs, it always, however, affects the liver. So what I usually recommend my patients, if they're on drugs, or they're just getting off of drugs, I should say, because listen to your medical doctor if you're on drugs and don't just get off drugs without consulting your medical doctor. But if you're getting off drugs, you know that you have an inflammation of the liver or you have certain congestion that goes on in the liver, because drugs always affect the liver one way or the other, and usually that's because they alter the chemistry of the liver. One of the ways I've learned that you can cleanse the liver is to take something called milk thistle. You can get this on Amazon.in. You can order this. Take about 3 or 4 of these a day. Sometimes you can take more. You can't really overdose on milk thistle. It's an herb. So that helps with that. As far as impingement, as far as the physical impingement of the nervous system or the spine or the nerves in the spine, chiropractic is your best source of relief for that. So if you come see your chiropractor, he will remove the stress, he will remove the physical cause of your pain and allow the nervous system to function normally. The third cause is mental emotional, and there are some techniques that I use for that. I don't want to go into that right now because it's quite lengthy. However, there are ways of resolving these issues within yourself so that you can get relief from pain that way. Let me just share a couple of the supplements that I recommend for pain, and one of them, and this is really good for inflammation and pain, is called turmeric. And turmeric, you can get this particular brand on Amazon.in, and just take about 3 of these a day, and you can take them with meals. Turmeric is a herb. It's also used a lot in food, and is very good for pain and inflammation. The second thing would be B vitamins. Get a B complex. B complex vitamins are very good for just overall health of the nervous system and the nerves. A third thing would be andrographics. Now there's a particular brand called Calmay, which you can also get on Amazon.in. This is really good if pain originates from bacteria source, viral sources, things like that. So each of these are chemical in nature. And of course I mentioned milk thistle. So that's about it. There's other ways to reduce pain. One of them is to get yourself an ice pack. And use it 20 minutes on, 2 hours off. This will reduce pain and swelling, especially for acute injuries. Now, if it's a chronic injury and you've got muscle tension, muscle tightness, heat is always a good thing to apply for that. If you're not sure which to apply, do a combination. Do both ice, 20 minutes on, 2 hours off, and then use heat, 20 minutes on, 2 hours off. And that should help your situation quite a bit. And don't forget to come see your chiropractor. Thanks for joining me today. I hope we can help you here at Whitefield.